and the support that is being given by the African Union. Welcome, Dr. John. You have the floor.
Thank you. And as always, it's a pleasure to be here every Thursday at 11 o'clock as we grapple with the COVID pandemic, which, as you all know, is raging through the world. And again, I would like to recognize the important partnership and cooperation that we are having with the media. It's been a very productive and impactful collaboration with respect to transmitting the messaging and messages from the AU to all 55 member states with respect to what the continent is going through and what we are doing. Let me start today by, first of all, acknowledging the multiple partners that that are supporting Africa CDC in these very, very difficult times. Excuse me. The Gates Foundation has been, the Bill and Melinda Gates Foundation has been with us from the beginning. Our traditional other partners, including the Japanese government, the China government, the US government, the Jack Ma Foundation, the Ethiopian Airlines, the World Food Program, the USAID, the Afro Champions, Welcome Trust, DEFIT in the UK, and the SCORE Foundation, a long list of that. The reason I go through all of this is to really show that how the international community is expressing a lot of concerns or support for the things that we are going through, and especially the forecasting that we might happen in Africa. So in terms of the situation, the epidemiological situation, as of this morning at 9 a.m. East African time, the number of global cases had reached 2.5 million cases across the world, with about 170,000 deaths. In Africa, as we speak today, 52 countries have been affected, and 25,901 cases have been reported from the 52 countries, with a resulting death of 1,242, giving a total case fatality of 5%. Let me maybe go back to the global and say that if you compare the cases between April 9 and 16, there have been a 39% increase within this period. And for the continent, we've noticed since the last time we met here, an increase of 43% from last week. So that is remarkable. And there are 5 countries that are on the top on the continent with a high number of cases. That would be Egypt with 3,659 cases, representing 14% of the cases in Africa. South Africa also has very similar cases with about 3,635. Morocco with 3,446. Algeria with 2,910. And there are 5 countries that 1,163 cases on the continent. If you look at these numbers on the continent and then you ask yourself the question, how do they match up with the population size per 100,000? You see that Djibouti will now be top with 98.6 cases, then Mauritius, Cape Verde, Seychelles, Morocco, Tunisia, Algeria, South Africa, and Equatorial Guinea. So this is trying to measure the number of cases by the population. The question most people are asking is that what is the fatality, the case fatality, which is defined as how many people are dying amongst those who are infected. The global case fatality rate is about 7%. And out of these case fatality rate, you see in Africa some numbers just for the discussion. Algeria's case fatality rate is 14%, so it's about twice that of the global average. Sudan, 9%, Liberia, 8%, Egypt, 8%, the Democratic Republic of Congo, 7%, and all of which have 100 cases or more. Again, the numbers are still small, numbers are still small, and as the numbers increase, the case fatality rate will continue to be measured. Just for the record, a case fatality rate for any outbreak is usually calculated at the very end of when the outbreak or pandemic is over. That way you truly know how many people were infected, how many recovered, and how many died. So, but these are rates that we are using now to gauge and understand where we are going with this pandemic. Some activities with respect to, excuse me, this Africa CDC response. In general, we continue to receive support from several donors, as I indicated earlier. Just last week, we received 2.2 million euros from the Welcome and the DEFI to support our COVID response. That is the Continental strategy, which we have all discussed here. We are also moving forward to looking at supporting 12 member states to be able to sequence the virus and understand the genetic makeup of the virus. This will allow us to understand the chains of transmissions as the epidemic or pandemic evolves. Africa CDC just completed an equipment footprint analysis focused on the molecular testing in a number of countries to understand exactly which countries can test using the molecular tests that we do, not the regular diagnostics, but the genetic analysis there. In the area of surveillance, Africa CDC is mapping personal protective equipment manufacturers across the continent to inform and facilitate private sector investment in the manufacturing of personal protective equipment on the continent. We've also launched an infection prevention and control series of webinars and has trained over 470 experts from 67 countries on assessing infection prevention and control preparedness and triage and patient flow during just this past week. The infection prevention control community of practice with over 200 participants has been set up, and a step-down training of over 400 healthcare workers has been conducted in Nigeria. The importance of this is that we are really trying to make sure that we develop programs that will enable us to prevent, or countries to prevent, infections of healthcare workers, which is the backbone of our response. With 6 weeks webinars have been conducted on clinical case management of COVID-19 in the past 1 month, with over 4,000 clinicians trained on the platform. 326 clinicians participated in the clinical community of practice webinar in the past 1 week. In the area of research and science update, Africa CDC is mapping the research needs of member states and the current research studies being conducted across the continent for infection control prevention for COVID. Current evidence show that remdesivir is the most promising therapy for COVID treatment-19. Positive reports have been obtained from Gilead phase 3 clinical trials, and preliminary results suggest that cases responded very well to treatment, and most patients were discharged in less than 1 week. But we still have to wait for the final outcome of that results. We are also tracking registered clinical trials on the continent, and these include Egypt, about 6 different clinical trials for drugs taking place in Egypt, Nigeria, and Tunisia. In terms of guidelines, Africa CDC has just published new guidance for community use of masks this week, and I urge that and count on you all to help us move that forward in terms of publicizing it, advocating for it. We are also emphasizing that face masks can be used to reduce the spread of infection in community by minimizing the shedding of respiratory droplets from infected persons who may not even know that they are infected and before they become symptomatic. So if you read the guidance that Africa CDC issued, you see that. Africa CDC recommends that community wearing of non-medical masks. I repeat, non-medical masks in settings where social distancing is not possible and where there is widespread community transmission. However, medical masks and respirators should not be reserved for use by, it should only be reserved for use by healthcare workers to ensure that we don't run out of those. And children below the age of 2 years should not be allowed to use or cover their faces using the face mask. And lastly, as we announced last week, that we launched a new initiative called Partnership to Accelerate COVID-19 Testing. We have already, since last week, rolled out 73,000 tests from our depot in Senegal. And this coming week, 500,000 tests will be coming from as part of the JACMA contribution, and that will continue to be distributed. So we are on course and meeting our target of rolling out 1 million tests in the next 4 weeks on the continent. We have 1 million tests that we've ordered already from Germany and is being shipped to our depot in Senegal, and will be arriving in Senegal, of course, this week, and they'll continue to roll that out. Our strategy is, as the tests arrive, we ship it out immediately to meet our target of 1 million in tests sent out in the next coming 4 weeks. Again, I count on the media, all of you, to help us, partner with us to make this a movement. And we are calling it, again, Partnership to Accelerate COVID Testing, with a tagline of track, test, and trace. Again, track, test, and trace. Thank you.
Thank you very much, John, for that very comprehensive brief on the situation on the continent, as well as what the African Union, through the Africa CDC, is doing to support member states in their efforts to combat coronavirus. Now, we have a number of questions lined up, so I will go straight on to the question that came through from Robbie from AFP, and he's asking, he says, the United Nations has called for a pause in flights of Ethiopian migrants returning from Saudi Arabia. Meanwhile, Ethiopians continue to be deported from Kenya and from Djibouti. Does the Africa CDC think these operations should be suspended to help curb the spread of the coronavirus? That is AFP.
I think we have issued guidance, which is on our website, on movement of people during this process, or this the struggle or the war against COVID-19. And we strongly encourage countries to adhere to our guidance, which is very clear. We published this since February the 22nd, when ministers of health were here. They endorsed that guidance, and it's on our website every time. We will strongly encourage countries to have a unified policy, and very importantly, as I've said on this in this press conference other times, is that human rights have to be at the center of our response to this. There cannot be any discrimination. There cannot be and should not be any stigmatization. Otherwise, we will not win the fight against COVID-19. I think that is very, very important.
Thank you very much. Now, you've mentioned in the past, before, this is another question coming in from one of our listeners about the importance of testing. Can you just explain to us if we are on course for the testing, and what is the situation like on the continent?
Yeah, the situation on the continent is is very restrained. As of this week, we've tested as a continent of 1.2 or 1.3 billion people, about 415,000 tests have been conducted. And if you square that by 1 million population, it results to about 325 tests per million, which is very, very limited. To put this in context, I mean, Italy, for example, has tested, has about 12,000 tests per million or more. And I think, I don't have the accurate figures, but it's in that range. So we need to do something to scale that up. That's exactly why the chairperson of the AU, His Excellency Musa Faki Mohammed, had launched this initiative and actually presented it to the head of states yesterday at the Bureau of the Head of States, where there were about 9 head of states briefing. He announced that initiative there to scale it up. Our immediate target is to move this to, as I said earlier, increase this in the next 4 weeks to 1 million, and then hopefully in the next 4 months to about 10 million or more. This will begin to change that ratio that I indicated from a very low number of about 325 per million to a ratio that will begin to be like 8,000 per million. I think that's where we should be heading to. As I keep indicating, you don't test, you don't find. And if you do not test, you are blinded. Okay, it's like you piloting a plane without your radar system there, and you may be surprised. Okay, and if you don't test, you are not ahead of the curve. We need to be ahead of the pandemic, not behind, not chasing the pandemic. So I think that is very important. If we do not test, we don't know how to open our economies. Okay, economies are now locked down, and the only way that would, one of the indicators that will allow us to begin to open up the economies or the lockdown is the testing, where we know who is infected, we isolate them, and then trace their contacts there. And that's the only, that is the importance of doing the testing as quickly as we can on the continent.
Fabricius from the Daily Maverick is up next. And Fabricius says, Dr. John, just to be sure, are you saying you will roll out another 1 million tests in the next few weeks, or will you reach an accumulated total of 1 million in the next few weeks?
No, we are rolling out 1 million new tests in the next 4 weeks. And as I said, when we did this announcement last Thursday with you, we started rolling out over the weekend on Sunday using DHL to channel out about 73,000 tests already. And this week, we'll continue that exercise from a depot in Senegal. And by the end of the week, when we receive the 500,000 tests from the Jack Ma donation, that will also increase that proportion. So we are moving. These are new tests that we are adding to the lot.
We move on now to Tufan Akhtas, and Tufan is with Anadolu News Agency. And Tufan has 2 questions. The first one is that in the last press briefing, you mentioned that 10 countries in Africa do not have ventilators. What is the current situation of these countries? And have you contacted any non-African country to buy the ventilators? That is the first question. And the second question is, the World Health Organization said that Africa could become the next epicenter of the coronavirus outbreak. Do you agree with this statement?
So, first of all, for the ventilators, some of those ventilators that will be coming through from the Jack Ma Foundation will be, those countries without ventilators will be prioritized. I think we are expecting about 300 of them to come through. And we are also working as the AU to have a pool procurement system where we have a platform which will allow us to unlock the supply, the demand and supply piece of it. So not necessarily buying it, but facilitating that countries should be able to access that the market there. So I think that is one thing. We have to recognize that we as a continent are competing for the same resources that everybody else in the world is competing. And if we do not pool ourselves together and have volumes, then it becomes difficult to engage any manufacturer. So that is what we are doing. Again, it's a process. On that note, I would like to make sure that I make this very clear. It is an uphill battle to build health systems while you need them. You always build your health system before you need them, not needing them and you building the health system. So that is what we are actually doing now. We're playing catch up, and that is a very, very tough thing to do because it has to be a process there. With respect to the second question was on...
The second question It was on the statement by the WHO
Yes.
that Africa is the next epicenter of the coronavirus outbreak.
The WHO statement is based on what we've observed over the last couple of months. And any country, excuse me, any country can be an epicenter or any region. I think Africa or the Latin America could be. It all depends on what we are discussing here, which is, are you testing? Are you finding the cases? Are you isolating and tracking the contacts there? So it's not a prediction that says it must happen, but if we do certain things, and the things that we are encouraging countries to do and in supporting them to do, which is essentially you test, you track, you test, and you trace. Again, you track, you test, and you trace. I think that's the only way to be ahead of the curve. But it has to come with a supply chain management of diagnostics. That's why we are so much focused on pushing out the diagnostics there. Another thing that I should mention is that we are also advocating for countries to have a very strong and robust and expansive system to employ community, engage the community so that it can use community workers. Not necessarily community healthcare workers, but community workers that can assist in the tracking and the tracing. Okay, so in case you test somebody somewhere and they are positive and they give you 20 contacts, the government alone cannot do that. So we have to rely on the partnership with the community to be able to reach out and trace those contacts there. And so Africa CDC is supporting this. We are already in the phase of deploying some of that in Cameroon as we speak this week, and we'll expand that to several other countries in the next couple of weeks. Our push is to advocate for at least 1 million community workers to support that effort. That is all part of the pack, okay? Because what South Africa is doing is remarkable. They are doing aggressive testing and aggressive tracing, okay, using community workers and mobile laboratories. I think that is, the reason that I explain this at length is that we don't necessarily need to be the next epicenter if we do the things that I'm encouraging countries to do. I think that there's not major. We have to simplify our response to COVID-19 to track, test, and trace.
Thank you very much for that comprehensive response, really encouraging for Africa to know that we are not necessarily going to be the next epicenter as long as we do the right things. We move on now to a question coming from Neil Manshi, and he's with the Financial Times. He says, are people in internally displaced or refugee camps at specific or heightened risks when it comes to COVID-19, and what are these risks?
So again, let me take us to the three pillars of our response, which is to limit transmission, to limit deaths, and to limit harm. So limiting transmission cuts across the board. And we know that the more you get people closer and in confinements, the more you promote the ability, or you enable the virus to transmit. So those camps that you indicated would naturally offer an opportunity for the virus, which we are trying to deny the virus the opportunity to spread. So I think clearly those vulnerable populations should be taken seriously. And we are working very closely with the Department of Social Affairs to make sure that we have begin programs that encourage partnerships to engage and ensure that we do the right things to sensitize those communities, engage them early on, develop champions in the community so that they should approach them with the right context, the right sociological and psychological context in those communities there. So yes, those are communities that we must pay specific attention to.
We have a question coming in from Della Russell of the Daily Graphic in Ghana. And Della says that you keep stressing on receiving additional test kits from the Jack Ma Foundation. Isn't it time for the African Union to sit up and stop relying on handouts from organizations? That's the question from Della.
Yeah, so Della, that's a very good question. As I indicated, that I'm acknowledging what partners are doing, not necessarily insisting on that. As I indicated, we, as the African Union and Africa CDC, have already bought 1 million tests that we are shipping out. But if you look at our target, where we want to reach in the next 4 months of 10 million, and hopefully in the next 9 months or 1 year to 20 million tests there, we need all kinds of partnerships there. That's why the word partnerships to accelerate COVID testing is important. So we are not relying on that alone. Secondly, is that we are going to, as a commission, be reaching out to the government of China to say, look, can we have quotas for the continent, that not donations, quotas that the Africa as a continent can purchase, which we have the money, countries have the money. Our limitation is the ability to pool and go in as one voice and access that market there, which, as I said, is a very competitive market. There are orders that have in place, and it will require 3 months or 4 months before those orders are delivered there. So Africa is not necessarily moving with a ball in hand, begging for tests, but we are saying you have to open up the market and for Africa to access it and buy it when they have the money. And I think many countries buying test kits is not what is above, is the access to the test kits there. And I will just end by saying that I describe this as a betrayal of the continent in technology. I think the first lesson we have to learn from this is that we have to rely on our own local manufacturing of diagnostics, which is not supposed to be very difficult. I think that is the number one lesson already emerging from this crisis is Africa's over-reliance on externalities to support our diagnostics.
Damien from BBC Online says, can I ask specifically about Madagascar? Can you address the president of Madagascar's promotion of COVID-19 organics, which he says is a treatment and a cure? This has only gone through 3 weeks of testing, and he will distribute across the country. Is this a good policy, he asks?
So I have not, I only heard yesterday that Madagascar and the president had found some, I'll call it medication or drugs. So we have not seen much of it, I think, and it's very difficult for me to comment on things that I've not seen. So I think it's fair to say that we'll look into that. We'll engage the government of Madagascar, and then hopefully next Thursday we can discuss that.
Peter Mwai, also from the BBC, says, we have seen some different stands over enforcing lockdowns across the continent, and countries that had lockdowns are relaxing measures. Do you have a general advice on lockdowns, and what should guide the government?
So I think we had been very clear. We were one of the first organizations to issue guidance on social distancing and including lockdowns, and with clarity of what to do. And when you have imported cases, when you have local transmission, and when you have community transmission. We issued those guidance a long time ago. Countries have reacted the way they reacted. I mean, we can only issue guidance to countries, and the decision of what countries do is all really up to them. As we speak today, there are 43 countries on the continent that have closed borders, and others have completely sealed up any entry into the country or exit. So, but we are watching that carefully, that space very carefully, and doing an analysis. For example, when we pull out 13 countries and analyze what happened since the lockdown occurred, you see clearly that there's reduction in new cases across the board. That is, daily cases across the board. That doesn't mean that the countries have controlled it, but it means that without the lockdown, you would have seen a more explosive outbreak there. So I think the lockdowns are definitely, of course, as you expect, playing a very important role. But as to how you unlock the countries is what we are working on now with countries, and working aggressively to say, well, if you've locked down your economy and the system, of course, there are so many other things that we know, and the third pillar of our strategy talks about minimizing harm. When do you unlock? So I think with other partners, of course, including the World Health Organization, we're looking into different criteria of how do you open up after you've locked down. But let me just add one thing, that the most important thing with the lockdown is not the lockdown per se, is what you do during the lockdown, which is you do exactly what we are preaching. You intensify your testing, your isolation, and your contact tracing, so that when you unlock the system, at least you have created a huge public health impact on the virus spread.
Thank you for that. Evelyn Kahungu of Al Jazeera English says, kindly share the names of countries using molecular COVID-19 testing and its success rate. And also please comment on excessive policing of a health crisis. And she says this is happening in Kenya.
So as we speak, there are 48 countries that have the molecular testing capabilities. Let me just say that, to make it short, is that all testing going on the continent now is still based on molecular testing across the 48 countries that are indicated. And we have not yet, we are still working on reviewing where we are, where we as the international global health community is with respect to the serologic test. So that are tests that are based on antibodies, not the genetic molecular testing there. With respect to Kenya, I mean, I don't think I understand what the question is, or neither have I followed closely what the issues in Kenya. So that I will not be able to respond to appropriately. But since you bring that up, I'll be very happy to put a team together to understand what is going on in Kenya.
We now have a question from Khadija Habib, and Khadija is with Bloomberg Channel. Do you have expected figures on the amount of aid some African countries may need? I guess this is in reference to the combating of COVID.
What I can say is that we have projections that based on population, based on the burden of disease, the projections for what the diagnostics may look like. That's why we came up with the 10 million and the 20 million needs, or 15 million needs. And we've done, or in the process of doing, completing similarly with other commodities, which are called commodities to support the entire spectrum of the response. So we will, we don't have specific numbers for every country, but you can only model and make projections based on the population and the rate of infections that are currently going on.
I see that we have colleagues who are joining us online. I don't know if you can hear us. We have a gentleman who's online. If you can hear us, please tell us your name, the agency that you're representing, and then ask your question, please. All right, it seems like the connection is not quite working. We go back to our email. Questions, and the next one is also from Khadija of Bloomberg Channel. And she says, some people talk about the possibility of testing vaccines on Africans who are in China. And that is the full extent of the question.
So I think vaccine we should distinguish between testing, clinical trials for vaccines, and the contribution of Africans there. There is absolutely a need for the world to develop a safe and effective vaccine for COVID-19. There's absolutely a need and urgency for that. I think we will turn the tides completely against the COVID-19 only when we have an effective vaccine. As we all know, in the history of infectious diseases, vaccines have been a game changer. I think that is. And secondly, Africans should participate in all kinds of research, not only as the trial participants, but also as the scientists or investigators. There's very, very many capable Africans that understand how to do vaccine trials, have done vaccine trials in very complex situations and clinical trials. For example, in West Africa, the Ebola outbreak was only brought to an end when we had an effective vaccine against Ebola, which was conducted at the peak of the outbreak and led by Africans and in Africa in collaboration with others. We live in an interconnected world, so I think that is one. That understanding has to be there. We also know that in the Democratic Republic of Congo, in this current outbreak, Professor J.J. Muyembe and the team led a very important group research that led to the understanding that we could use some monoclonal antibodies to treat patients, and that became also a game changer. The point I'm making is that Africans are very capable of conducting clinical trials, so that is one thing. But the narrative that emerges is wrong. The narrative is that Africans will be used for vaccine trials and as if they are guinea pigs is wrong. If today there is a safe candidate vaccine, I repeat, a safe candidate vaccine, I'll be the first person to take part in such a trial, okay, period. And the trial should be guided by good ethics and good science, okay, that is the backbone of what drives all clinical trials, so that we do not run into issues of, and the same standards that are applied in Africa should apply in Europe or America or China there, so that there's no special consideration or approach to Africans and then a different approach to others there. If there's a candidate vaccine today and the scientific community says that it is safe, I will be the first person to take that vaccine on the continent.
The next question is also about China, and the journalist says, Dr. John, many are demanding compensation from China for failing to give the world adequate notice of the virus. Do you agree? Also, please repeat what you said earlier about the most promising treatment.
So there is the China piece. This is my views about the situation with COVID. We are at war with COVID-19. We as a continent are still struggling to focus on strategies to make sure we don't get to where the others are predicting. That will be the epicenter. We are doing our best as much as possible, hoping for the best, but preparing for the worst. So the point that I'm making here is that for us, it's too early to know, to apportion any blames now. Our focus is we keep an eye on the enemy, which is a serious threat for the continent, or a looming doom for the continent, which we should continue to pay attention to and make sure that we deploy all tools in our disposition to focus on the first pillar, which is prevention, limit transmission as much as possible. When this is over, and it will be over, then the world will look at not just the role of China, but the role of everybody, including Africans. What did we do as a continent? What do we know? When did we know it? And what did we do? And so it will be an after-action analysis where everybody will look into, all of us will come in and look into the different roles and responsibilities and draw lessons of
Addis Ababa, Ethiopia, and welcome to this scheduled Thursday morning press conference. Addis Ababa, Ethiopia, and welcome to this scheduled Thursday morning press conference, which we hold at 11 a.m. East African time, and that is 8